Your timer, and here is your question. Right. So if you have read and understood, considering it critical care scenario, kindly please tell me, how would you manage this patient?
I will manage this patient using ATLS protocols.
Yes.
In my case,
Yes.
The primary survey, I want to do ABCDE of primary survey. The A, I want to assess the airway and C-spine.
Yes.
Want to check the airway. I want to bring the C-spine using sandbag tapes and neck collar. That's triple to immobilize the spine. That's triple immobilization.
Yes.
I want to call the patient. Patient is response means the airway is stable. If not, I want to check the mouth for any denture, any tongue falling backward, and I want to manage this. I want to do a chin lift and jaw thrust to avoid head tilt.
Yes.
Then the next be the breathing and ventilation. We'll check the patient oxygen saturation and the patient is breathing.
Yes.
To the patient in high flow oxygen using the non-vital face mask at more than 10 liters per minute. Then I want to check the chest expansion of the patient, check their centrality. If there is pneumothorax or tension pneumothorax, I want to do sleep thoracostomy. I need to do thoracostomy and thoracostomy if there's a chest, if there's a tension pneumothorax. Then I want to see and check for circulation and control of pulmonary down to whiteboard cannula, take samples for here and fasting blood glucose.
Okay, just suppose you have assessed the patient and you have evaluated that patient is in hemorrhagic shock. Considering the injuries the patient has, what level or what grade of hemorrhagic shock the patient is in?
Could be grade 4 hemorrhagic shock.
Yes. How would you classify that?
Some probably have lost about 2
Sorry?
liters. Grade 1.
Yes.
It's class 1 to class 1, 2, 3, and 4. Class 1, about less than 750 mils of blood, less than 15%.
Yes.
Blood is lost. Class 2, 750 to 1,500. Class 3, 1,500 to 2,000 mils blood loss. Class 4, greater than 2,000 mils. And then in class 1, the pulse is less than 100. Still greater than 100. Class 3 greater than 120. Still greater than 140. The blood pressure is normal in class 1 and 2.
Yes. Can you please tell me, considering class 4 of hemorrhagic shock, what should be the urinary output?
The urinary output should be less than 5 mils per hour.
Yes. All right. How would you classify the mental status to be?
The mental lethargic.
Lethargic. Okay. How should a patient in hemorrhagic shock class 4 be managed?
So the measure we need, I want to start with fluid station and group and cross match for units. We definitely need to use with blood, pack cell volume.
Yes.
Pack cell,
yes.
platelets, and fresh frozen plasma.
Yes. How much IV fluid would you consider for that patient?
Once I give 1 liter starts, within that period, I want to ensure blood is ready and I can start the transfusion.
Okay.
As soon as possible. This patient needs to be monitored in
yes. How
high
would you?
dependency unit or intensive therapy unit.
All right. Can you tell me how would you monitor the response of the patient?
To monitor the response, I want to check the vital signs, the pulse, the respiratory rate, the capillary refill, the blood pressure, urine output, and invasive monitoring, central venous pressure, base serum lactate, and base deficits can also be measured.
Okay. Can you please tell me if you'll do, what images would you do for this patient?
I want to do trauma series.
Okay.
Can you? AP, chest X-ray AP, pelvic X-ray AP.
Yes. Would you be able to help me and read the image you're looking at? What kind of image is this?
This is C-spine X-ray.
Okay. Showing what, please?
Lateral view.
Yes. What do you see?
Yes, I can see.
How should a patient, yes, with susceptible C-spine injury be managed?
Fracture.
Yes. What level?
I can see burst fracture, multiple cervical fractures.
Okay. How should a patient with a suspected cervical spine fracture be managed?
The patient should have simple immobilization with rigid collar, sandbag, and tape. So
yes, very good.
And should be rolled.
Yes.
It needs to be exposed to check other injury.
Yes.
Patient should be positioned in 30-degree head up.
Yes.
And analgesic should be given, and high flow oxygen, and jaw thrust to avoid head tilt, not to convert the stable spine to a stable C-spine injury.
Okay. Can you please tell me? Yes.
MRI of the.
All right. Can you please tell me? All right, you've done this. If you can tell me, what do you understand by the primary survey and the secondary survey? Primary survey of the patient or injuries, and the secondary survey, how would you define that?
Primary survey is to check, to look out for immediate life-threatening condition. Either during the ABC or ABCDE resuscitation, checking the airway, C-spine, C-spine. Then B, breathing and ventilation. C, circulation and control of hemorrhage. D, drugs and disability. And E, exposure and control of
okay, can you please tell me?
To prevent hypothermia. Then following this one to do adjunct to primary survey, which are the investigations and the X-rays and blood investigations. The secondary survey is to prevent potential life-threatening conditions.
Yes. Can you please tell me, how would you ensure or how would you manage the circulation of the patient when patient is in grade 4 of shock?
To manage circulation, I want to check the pulse, the rate, the quality, the rhythm, and then also want to check the blood pressure of this patient, check the capillary. If there is external blood loss, I want to secure hemostasis as soon as possible.
Yes, good.
Internal blood loss, I want to identify where the loss is and to do a damage control surgery as soon as possible. Patient need blood, I will get a deeper proximal and transfusion. It's appropriate.
Good, very good. Okay, good, thank you.